Good evening and welcome to the live for the show we have entitled The Heartbeat Live. Heartbeat Live. And it is where your rhythm for life and healthy life exists. My name is Dr. Oteng.
And I'm Dr. Gifty Oteng. We are so glad that you are with us tonight. I don't know whether you're watching us in the morning or in the afternoon. We are glad that you're joining us as we tackle one of the hardest topic, as you mentioned, right, in medicine now. And I'm sure we keep hearing this everywhere we turn, right?
That's right. Everyone is talking about the GLP-1 drugs. Like most popular one, I think, is Ozempic
Ozempic.
for weight loss, right? But there's others. We're going to be mentioning some of them. But tonight we are going beyond the scale, to tell you the untold story of how these medications can actually do some very other important stuff that you may not have talked about. Some stuff about your heart, the most important organ in your body.
For our pulse check tonight, did you know what major clinical trials have shown that some of these drugs that we are talking about, the Ozempic, the Zepbound, the Wegovy, can significantly reduce the risk of heart attack, stroke, and cardiovascular diseases. Are you aware of that information? So especially in people with type 2 diabetes.
Yes, definitely. And that is
So it's a
important.
huge game changer. But there are details that you may not be aware of or you need to know. So we are here to share that information with you.
That's what's up. There are certain details that some of us don't know, and we want to take this opportunity to break those down. As much as there are details, we're also going to be quick. So stick with us. Don't go anywhere. So let's start at the beginning then, right? Like Gifty, beyond blood sugar, weight, and other things. What are GLP-1 agonists? And what do you think they are? I'm just going to start showing my slides so that we can also show people as we go forward, right? All right. So what are GLP-1 agonists? People may say, what are you talking about? Yes, go ahead.
That's a great question, right? So these drugs mimic the natural gut hormone, the GLP-1, while that help with insulin and feeling full. So the untold part is that receptors for this hormone are found all over our body. Okay, so including the heart, the blood vessels. So we have this GLP hormone in our body. So that's what we are talking about.
GLP like hormones, and the receptors are all over. That's the key here. The receptors for that is all over the body, including on the heart, and that is why we are having to deal with certain other benefits that we are talking about. And so that's the real key right now. So, how do they directly affect the heart then? We have a lot of studies. We actually went through some studies on online to see how some of these things come about. And there's a lot of studies. Studies suggest that several ways exist. First, they can help reduce inflammation throughout the body. And if you are a regular on this channel, we always blame inflammation for everything. It's a bad guy, right? And so inflammation throughout the body. Also, it's a major driver. Inflammation is a major driver of plaque buildup in the arteries. Yesterday, I was talking to a group of people from my old school, and that's another point that came up over and over again. Plaque buildup due to inflammation, which also then leads to what we call atherosclerosis. Atherosclerosis is the one that is the major problem.
So aside the atherosclerosis and the other one that you mentioned, it can also have a direct effect on the heart muscles itself. And that can help improve the way your heart function. So that is also important when it comes to the heart.
Yes, that's very important. So atherosclerosis leading to plaques and all the rest, and then affecting you in that regard.
So as it help with the heart muscles, right? It's control or improve blood pressure, and it's also work on the cholesterol level, like the LDL and the triglycerides. So this one is really impacting a lot of things in our body.
It
The
is.
GLP.
It is. It is definitely. And we will not just stop there. We are going to describe, talk about the details of some of them. But except to say that, if you're looking at the slide, we also want to say that it helps the insulin release. GLP-1s helps with insulin release, thereby causing your blood sugars to go down. And then also, it makes you feel fuller longer. So in another way, scientifically, we say it delays gastric emptying, which basically means that when you eat, instead of things just going through you and you passing it out, it slows the movement of stuff away from your stomach and your intestines. So if they are there longer, then you don't feel hungry, and so you don't eat more. And so that is another way that we can talk about it. So I think there's another one you want to
Yeah, and it also protects for the heart. As I said, that it affects the heart muscles, right? It protects the heart and the kidneys.
Yes, yes, yes. And the benefits on LDL and triglycerides, as you said, are huge. That is why we have actually entitled this show that there's something else that you don't know about it. It's not just about weight, but there's something else that you want to also think about when we talk about these things because of their benefits on the heart. And that is where we want to dwell because most people know about the glucose lowering and the weight loss, but not everybody knows that it is also something that is going to be helpful for your heart health. And so we are going to also talk about that. But before we do, let me see if I have any other interesting slide that we can talk about on there. All right, so this is talking about just Ozempic by itself, right? So Ozempic by itself. If we want to just focus on that a little bit, so according to studies, and I'm pretty sure from the clinical research data, you can see that Ozempic can lead to a weight loss of between 6 to 9 pounds, and that is over compared to a placebo or for people who are not getting that shot, compared to somebody who is not getting that shot, which is a placebo. And then when it comes to diabetes, it is also, I'm hearing some noise, that's why. When it comes to diabetes, I don't know why the noise, but hopefully it's not distracting anyone. When it comes to diabetes too, it is known to lead to A1C reduction of about 1%, which is not as huge as you think it would be, right? Because when you talk about diabetic medications and A1C, 1% is really not that great, right? But I think we're discussing before we actually came on. I think there's more benefits for the glucose control as after your weight loss comes in. So eventually you're going to get the most benefit with the glucose with the reduction of the weight as you go forward. So that is potentially the reason. You want to talk about also the heart risk reduction?
Yeah, so I was also disappointed. I'm like, it's only 1% reduction because in our show, we encourage people to eat right, to exercise, to do other things. And sometimes the drop is bigger than just 1%. And we are talking about the price. Ozempic is not cheap at all. It's very expensive. So if you're going to inject yourself one shot, a week, and overall your A1C just dropped 1%, that was a little bit disappointing. But we also came across this fact that you reduce your risk, the risk of heart attack, the risk of stroke, and is you reduce it by what, 26%?
26%. That is huge.
26%.
That's where I think that's where the most benefit is. Even though people don't seem to look at that as much for diabetics, but I think to reduce your risk for heart disease, heart attack, heart failure, whatever, stroke, all cardiovascular endpoints by 26% is huge. That's like the deal breaker for me. I don't know how many heart medications can boast of a reduction of risk of heart attack by 26%. And if you are using something or injectable for diabetes, and then you are getting this benefit, then it's really a big deal. So I think that is something that we will talk about. But before we continue with Ozempic, I also want to say that so who are the best candidates to receive these medications? Is it for everybody, or it's some specific people? Because you can't just give it to everybody. At least in our practice, we know that insurance companies don't pay for everybody, right? But who are the people that will benefit? The major trials have focused on people who have established type 2 diabetes. Well known, in fact, they have established type 2 diabetes, and also who have known cardiovascular disease or multiple risk factors. So you have type 2 diabetes, maybe you have heart problems or known cardiovascular disease as risk factors for stroke, and the rest are also accompanying your diabetes. Then this is where it becomes very, very important. And that is where the strongest evidence for heart protection actually exists. So it's not just for the diabetes, but for people with type 2 diabetes who also have these accompanying or associating cardiovascular issues. That's where the most benefit is. So people just look for it for weight loss, but trust me, that's just a small part of it, right?
Yeah, I think there is a lot of talk about weight loss and Ozempic, right? People are just looking at the surface. The true benefit here that we are trying to bring across is the lower risk of heart attack and stroke, especially if you're diabetic. And the studies are there to support that. So it is crucial also to talk about the potential risk or concerns. From a pharmacy perspective, we see these drugs have significant GI side effect. So I think we call it gastroparesis.
That's one, gastroparesis. Just make it simple as nausea and slowing down of gastric emptying. Which becomes a benefit though, right? Because if you have gastroparesis, things are not moving down quick enough. So you feel like you are nauseous all the time. But then that also in itself will not make you eat. So then you lose the weight.
Right.
So come on, man.
But sometimes it increases the risk of constipation. The constipation is very huge. Because you are retaining it for long, you tend to have difficulty using the bathroom. So you used to use the bathroom set and you are able to empty yourself, right? But this time it becomes more difficult because of the medication. So I think people are recommended, if you're on that medication, to take in more fiber, and that will also blow you up too.
A little bit.
And a lot of water to help in that situation. And there is also another thing about the rapid heart rate in people taking that medication, and the need for more long-term safety data, especially people that are just taking it for weight loss. There are not a lot of study out there, so we need more data before we can conclude its safety. But for now, what we have out there is that the heart rate, you tend to have a higher heart rate, and
nausea,
and the side effect of not able to use the bathroom frequently.
It could also be the other way. You could also have diarrhea. When it comes to gastrointestinal issues, everybody is different, right?
Yeah. So the way you react to it may be different. Yeah.
So we have covered some complex information on this, and we want to hear from you also. So if you are watching, don't just be quiet. You can put your comments on there and make your questions known so that we can go together. But with that being said, I'm going to go back to our slides and see what else we can learn about Ozempic and some of the other stuff that we know about. All right, so how Ozempic changes life? How does Ozempic and the GLP-1s, of course, change the lives that we are talking about? It's really popular for some people. As a matter of fact, like I'm saying that in our line of work, we see it all the time. We have people paying hundreds of dollars just to make it.
1,200,000
and
every month.
You said some people even pay
Out of
outright
pocket.
because the insurance will not pay. And I'm hoping that they're doing it not just for the weight part, but maybe because of the cardiovascular or the heart disease problems that they are trying to treat. Because that is, for me, it's even more huge. Because for 26% risk reduction it's huge compared to the diabetes, which is just 1%, right? So yeah, how does Ozempic change lives beyond the numbers and real benefits? The real benefits include also improved energy levels. So people who have been on Ozempic and the GLP-1s, we should group them together. Ozempic is more popular, but most of these people report having better energy levels, right? Yeah. And then they are also better able to move. Of course, if you're losing weight, you're going to be able to move around, right? Yeah, right? You're going to be able to move around. So that is one. And then the last one is reduce reduce dependence on other medications. So some of these people may have been told to stop their insulins, may have been told to stop their metformins. Not everybody, but some people may have to stop because, of course, the addictive side effects may be too much. For example, the GI side effects along with metformin side effects may not be bearable, so your doctor may tell you to stop. But aside that, some people have enough benefit from the Ozempics and the GLP-1s that their doctors or their caregivers may tell them to go off of some other medication, which is a huge benefit. Reducing the drug burden on some people. What do you think about that?
Yeah, so I think the other popular one, people wouldn't say the Ozempic per se, they will say the generic name. So some people are selling.
Oh yeah, the people who are getting it online and stuff.
Yeah,
they call it
so
semaglutide.
Semaglutide. So if you see semaglutide, it's the same as Ozempic. It's just a generic name
Right.
of Ozempic. Yeah. So I think the benefits are huge. But like I said, the data is not completely out there. It's a newer drug. So most of the data are not a lot for us to rely so much on it. But the little study that they've done show these numbers, and it's very promising. And people are paying a whole lot of money. They're paying a lot of money. And I think most insurances have revised their formulary to the point that most of them are coming up with other medication, other GLP medications that they do cover because of the benefits that comes with it.
Definitely, because of the benefits. Because soon, if you're an insurance company and you don't pay for these very popular drugs, like I'm saying, like gold mines now, as far as medications are concerned. If your insurance companies are not paying for them, I'm pretty sure soon they're going to lose business because people will switch for other companies who pay for them, right? So yeah, it's very expensive now. Hopefully it's going to become cheaper. They're going to become cheaper. But until they get cheaper, the insurance companies are going to be forced to reduce the prices because they are doing wonders. When we were planning for the show, I was thinking about bringing some celebrities who have posted photos of themselves one size, and then after a GLP-1 use, whether semaglutide or tirzepatide, how they have lost weight and how they look fit and all that, and showing the world the difference. So this is like a gold mine now, and insurance companies are going to have to be forced to pay for it. Now they have the upper hand because by the fact that the demand is so much there, even if they don't pay, some people will pay out of pocket. But soon, people are not going to choose coverage from companies that do not pay for them. So that is something that we need to know about. But with that being said, let's see if there's anything else that we can say about them. Well, there's another one which we don't want to spend much time on. We call it Victoza or liraglutide. It's fallen a little bit out of favor now. I don't see it as much. They were the earlier ones, but that being said, because we are talking about the heart benefits, we just wanted to just showcase it also, so that if you are not on the most popular ones like the Manjaros and Ozempics, at least if you are on this, you know that you also have some benefits there, especially for heart disease.
So the Victoza here shows what 22% reduction
Risk reduction in heart disease.
in the heart disease and stroke,
That's
which
huge.
is a huge thing. So I think initially the practice was to add on to people with diabetes so that they reduce their risk of getting heart attack or stroke when they have diabetes. So it was an add. It's still
It's
an
still an
add-on,
add-on, yeah.
add-on medication for people with diabetes, just because of the benefits with the heart risk. But if you look at the A1C, it reduced it by only 0.4%, and the weight loss is not as huge as the others. So this one here is only 5 pounds, which is still something, because to lose 5 pounds is not easy to do
not
it
easy.
all by yourself. Is not easy at all. But with the Victoza as a diabetic, it's an add-on. Some doctors will add it on to your medication just to protect your heart, to prevent you from getting heart attack, and you still lower your A1C to a point and still lose weight.
Definitely. So while it is not as popular, if you are a diabetic and it's added to you, to your regimen, don't be quick to say, no, I want Ozempic instead. Maybe your insurance will pay for this one. It's okay. It's okay, though you are getting only about 5 pounds weight loss. Trust me, before the Ozempics and the Wegovys and the Manjaros came, we are not getting even 5 pounds from anything for that matter. So it's still good. But the main thing you should focus on, which is the focus on this show, it's not just the weight loss, but the fact that your heart disease risk is going down. In the United States, there's increase, not just in the US, increase in heart attacks or heart disease risk in women in particular. A lot of women are dying because of heart disease. And so if your doctor deems it necessary to add this on to your regimen, you're diabetic, don't say that I have to get the other one. If your insurance will pay for this, you're getting 22%. The other one, the top one was 26%.
25,
Yeah. So 22 versus 26, it's not huge. So definitely Victoza or liraglutide.
Yeah, and
would be
also
an
you
option.
may not be the one with even weight issues, right? Your weight may be right there,
Yeah.
and you don't have to lose a whole lot.
Right.
So if you are such a person and you are just diabetic but you are not overweight, then this one would be a better choice because you are going to get the benefits from the heart issues, which is 22%.
And that's a very good point. Not everybody wants the weight benefit. Yeah.
Yeah.
Some diabetics are skinny,
Yeah.
and you don't need to be on Manjaro, Wegovy, or Ozempic for that weight loss portion. Yeah. So for your case, getting the Victoza or the liraglutide may be all you need because you are taking care of your heart issues, protecting you against heart attacks and stroke, which is usually associated with diabetes and other risk factors. So that's a very good place to move on to the next slide if we have another one here. And still on the Victoza, we say it's good for the heart protection. And there's a clinical trial shows reduced heart problems by 13% in most clinical trials. So I think we said enough about that. Now, the other drug is what? Trulicity. Trulicity, we are not also going to spend too much time on it either. It is, I would say, it's a sister, or should I say a brother? Since we have more women on the planet, we should say it's a sister
Of Victoza.
of Victoza or liraglutide, right? And it also has some benefits in terms of weight. You know, it leads to modest weight loss over time. And so, if you are still on Trulicity, you are still doing good. You don't have to switch to the most expensive ones, especially if the goal of your provider or your physician is to reduce your heart disease risk. Then you are good. You are good with that. Anything to say on that?
Yeah, and the blood sugar, right? It's also consistently improve your H1C. I think they didn't put a number on here.
A1C, yeah.
A1C, yeah. So it just also manage it for you to a point. And the heart rate here and the heart attack reduce your risk by what, 12%? 12%. So any heart problem, heart disease, heart attack, stroke, and all that, it reduces it by 12%.
And 12% is huge.
It's huge.
12%
It's
of risk reduction is really, actually, really huge. So definitely something that you can enjoy it in that respect. And actually, on the A1C level, I have the data here. It says about 0.6 to 0.8%. Again, not huge. Yes, for the Trulicity, not huge. But again, for heart disease, remember, we are on the Heartbeat Live. We want to make sure that you are also taking care of your heart. So if you are diabetic and you are getting protection for your heart through the use of Trulicity, along with modest weight management, then you are good, right?
Yeah.
All right. So the next thing then is the other advantage of for Trulicity. I don't know if it's important that we can mention.
Easy to use, so it's in the pen form, and
that's
it's
not
weekly.
Just for Trulicity, it's for all
it's
of
for
them.
all of them.
Yeah. So yeah, once weekly use or dose, and it's injectable that you inject subcutaneously. Not too painful. I know some people are, no matter what you say, they are afraid of needles, but this is something that will bring you most benefit. So not too painful, as long as you do it the right way. And then what? It works for both new and long-term diabetes patients. So that is another thing. All right. So now let's move to another one, which is Wegovy. And I think this is the one you like a lot.
Oh, I do.
Right.
That's a semaglutide, right?
Yes.
So just like the Ozempic being semaglutide, the Wegovy is also semaglutide. And I think the Ozempic is more like for diabetics, but the Wegovy is solely approved by FDA for weight loss, right? And this is a weekly injection, and the average weight loss is 15% of body weight.
That's
15%.
15%
huge
of your body weight.
Yes.
And so all these celebrities that are walking around, with new photos and pictures of how much they have lost, I'm pretty sure they are not telling you all the reasons, but at least now you know that they are probably using Wegovy or Manjaro for that matter. One of the two which are approved for weight loss would be what they are using for. And the thing is not just for that, they also help with blood sugars, and obviously with cardiovascular health.
Right.
So they all help in some way in all three areas. You lose your weight, your blood sugars become better, and your heart is also protected. So 3-prong attack on your health on your body for a better health. So, but there are differences. The differences are which ones control more of your weight, which ones help with more of diabetes or blood sugar, and which one helps with more of your heart condition. Right. That's where the differences are. Apart from that, it's not much different. Most of them are actually the same generic or active ingredients, but the dose may be slightly different, right?
Yes, so with this one, when they did the clinical trials as compared to placebo, people that were taking using the Wegovy lost about 33 pounds as compared to 5 pounds with people that were not using anything at all. So you can see that 15% of body weight is really huge.
It's really huge. I don't know, but that's a big number to lose 15% of your size. It's not a small joke here. So that is Wegovy for you, and people who do it right. Of course, as we go through, we are going to say something else before we close, but it's not just that. You got to do certain things along with. Some people are just using that. They're not doing anything. That is not the health approach, the health way that it should be.
And it goes beyond weight loss. So the study also has proven that it's also reduced blood pressure. It's also improve your lipid panel. So your cholesterol is also checked. The LDL start going down with the Wegovy, and your blood sugar is also controlled. So your insulin become more sensitive, so that you're able to process food that you eat and consume. So it's the metabolic panel. It cuts all across. Blood pressure, cholesterol, and blood sugar is all controlled under Wegovy. So end of the day, it's not just your weight; it goes beyond your weight.
And that is why you should not just look at it for the weight portion. You have to look at it for total health. And I'm just so happy about the fact that, something that was looked at initially for diabetes has become so good that now not only diabetics can benefit from this, but anybody with any metabolic health issue can use this if they can afford it or if the insurance will pay for it, and they can protect their heart. So that is something very huge that we can.
Yeah, but if you look at it in a different way too, you can see that how weight is linked to all these things that we are talking about. You
Yes.
see, when your weight is high, it's likely that your blood pressure is high, your cholesterol level is high, and your sugar is not well controlled. So by controlling your weight, you cut across that your blood pressure is being controlled, your cholesterol is getting to a point, and your sugar is also getting all regulated nicely, all because you are losing weight.
Or because you're losing weight. So this is a magic bullet, right? Magic drug, right? When we were kids, we some people saw drugs that cured every disease. I think that is what I would think was the corticosteroids. Corticosteroids like prednisone and stuff. We use it for everything.
Right.
Asthma, allergies, inflammation of every kind. But these GLP-1s are potentially going to replace that.
Lots of medications.
Yeah, because of the broad nature of how they help. And so it is good. It's really good. The only thing is, I think we hinted that earlier. There's not long-term studies. So yeah, people are using and benefiting right now, but we don't know because it's not been studied for so long. It's not been used for so long. We don't know, like 10 years from now, or even 15 years from now, what are going to be the implications of using it for a very long time. That is the only thing that is still not known, but studies will definitely bring those pieces of information up as we go forward, right? So we will let you know if anything comes up. But the other thing that we want to talk about is another one. This one is not as popular, but we just want to mention it because somebody may be watching us and they're using it. It's what we call the Saxenda. It's also the one that we talked about, Victoza, liraglutide. It's another kind of Victoza. Just the same ingredient, but potentially different doses. Yes, this one is 0.3 milligrams instead of the Wegovy, Victoza, which was 1.8 milligrams. So it's the same one, but a higher dose. And I think they were targeting weight loss with this one. So they increased the dose. And the weight loss, average weight loss, as the slide shows, is 14 pounds. If you compare it to the Victoza, which was less, which was only 5 pounds. So with the dose increase, they gave it a different name, and now it's for weight loss. So if somebody is diabetic and also has a huge weight and they want to deal with that weight, you can use this one. And then somebody who is diabetic but they are not overweight, they can use the Victoza. And both of them will benefit. So depending on where your situation is, your provider will decide which one to use. I don't know if you want to say.
And I think you mentioned that sometimes the lower the dose, the higher the protection part of the heart.
Yes,
right?
yes, sometimes, yes,
Yeah.
yes.
So sometimes, like you're saying, you don't need the higher dose. You just need to protect your heart. Your doctor will decide which one works best for you. But nowadays, because of internet, because of TikTok, because of this information out there, people are just using things anyhow, and people are buying these drugs online and doing all that. You have to really make sure which one will most benefit you by working with your doctor. That is very important.
Definitely.
Work with your doctor, and the doctors are willing to work with you as long as the outcome is favorable and something that will definitely benefit you in the long run. You just don't want to take matters into your own hands and just do because people are talking about it. You can see that people out there, they don't have the credential, but they're selling these items. So you have to be careful and know where you are. You have insurance, get hold of your doctor, make an appointment, talk it out, discuss it, and the doctor will give you the right course of action so that you don't harm yourself in one way or the other.
All right, now let's move on and see if there's any other one. So I think this slide is just saying weight management options. Wegovy, yes, as we say, Wegovy and Saxenda are FDA approved specifically for weight management. And I think there's more. Zepbound also. It's not just these two. Zepbound also. My AI is not smart enough to remember that one. All right. And so that is that. So for some people, they may just take it for the weight loss. Other people may take it for the diabetes and weight loss, and other people may take it for any other indication that the doctor may actually think is necessary. So how do these medications work? I think we may have touched on them. As far as helping you to curb your appetite, it works by slowing your stomach from emptying. So if you eat and you have this injection on board for the 1 week, your stomach holds on to the food longer, and so it doesn't go right out. So you don't feel like you're hungry, you want to eat again. So that is that. And then also,
it's also signal fullness to the brain when you start to eat a bowl full of rice
and you start to
eating.
Right?
Yeah, there is a signal that sent to your brain that, oh, you're full. So if you used to consume a whole lot because you are on this medication, you tend to feel full quicker with this portion size being controlled for you. You are forced to like this, your body to tell you that you can't eat anymore. Even if you try harder, you can't. Because your brain your brain is telling you that you are full. Harder. No, you can still push it down because your brain is telling you that.
The reason I bring it back, I mean, I have had some times that I know I'm full, especially when the food is so good.
Yes.
I thought I was full, right? Mm-hmm. And then I kept eating because I enjoyed the food so much. So when you say if you try harder, I'm not sure if that's going to cut it. I think people have to be really actively involved.
Yes.
If you say you are going to overeat, and
even with the medication,
you will still do it because apart from the signals in your brain, you also have to be disciplined. Because how many times have you felt full and you ate? I'm just talking about myself. But
you were not taking any medication, so...
That's true. Maybe I should try it and
see how the mechanism works for you.
Maybe I should. Yeah.
Yeah. Because I know some people will be like, they can't push it down, even if they try harder. Because sometimes if you force it, you may puke, or you'll be so uncomfortable that you can not help it.
Have you had any patients in your practice that told you? Okay.
Yes.
All right.
So, and some people, another person also mentioned that when the medication goes out from their system, then they cannot stop eating. They will eat and eat and eat and eat and eat. Then she's like, don't tell anybody. She added that, no, don't tell anybody. Because she said when it's a weekly shot, right? So when it's about the 5th day, then she feels like there is no, like the medication is not working as well. So she said she will eat and cannot stop eating, So, but whenever she go back and inject again, like the week start, he is able to control her appetite. So I think at the end of the day, we shouldn't, we can throw it in there that we shouldn't just depend on the medications so much. You just have to try and still do all the right things, the choice of food, the kinds of foods, the portion size, even if you're on the medication. And I think that would even work better if you do it that way.
That would definitely work better if you do it that way. All right, let's see if there's any more things we're going to... so some of the side effects, I think we also had on some of them, but just to be complete, we said nausea, vomiting, diarrhea, but they usually improve over time. When you begin it, you find out that you get more of these side effects in the beginning, but with time, your body adjusts. Just like in metformin, when you begin, it could tell you that, hey, stop, don't take this anymore. Or even metoprolol, you feel very horrible in the beginning. But if you keep taking it, if it's something that is not like really unbearable, then eventually your body will adjust and you become fine. And I've seen people who have increased doses from say 2.5 after 4 weeks, and they go to 5 milligrams if, the next month, and they still see the side effect not as huge because their body has become used to it, right? So
And I've seen some people that go up dose and they cannot function. So the doctor have to drop them back to the lower dose because they are not able to handle the side effect as well. So depending on how you are, definitely working with your doctor,
yes,
will help you, because the person was saying that they felt sick. They couldn't function at all. And she has to be dropped back down to a lower dose to be able to tolerate the side effect.
And the other less common but serious side effect, is pancreatitis or gallbladder issues, especially for pancreatitis. So if you are on this group of medications and you have abdominal pain, deep abdominal pain radiating to the back, make sure that you talk to your doctor about it, and do not just ignore it. Again, it's not common, but when it happens, it's serious. So that is another side effect that happens with the entire group of medications, I should be saying, right?
Yeah. And another rare one is the thyroid tumors, right? That was found in animals. It has they are still collecting data. So I think that if you open the box, it tells you where to report any of the side effect. So if you're taking any medication, they've provided places that you can report any new side effect that is not listed on the paper that comes with it, so that they can keep collecting data and upgrade or update as time goes on, so that they can catch all the side effects. Because as we all know, when they do the clinical trials, they just pick a group of people, like not the whole. Now almost the whole population is a lot more people are taking it, so they may have missed any of the side effects. So they've created a space or a place that you can report side effects that you encounter.
And you can, even if you don't know, you go to the FDA site. There's a link there that you can always report adverse events that may not be listed, or even if it's listed but you found out it was serious with you, whatever it is, you can report it so that more information, more data will be collected, and then maybe next time when we talk about it, we can tell you additional side effects that may have been found. But that being said, overall, it feels like it's safe. I've seen bad patients that have been on it for months and doing great. Again, the long-term studies have not been done yet, so we can't really say how they are going to feel or if there are any long-term issues. For example, like the thyroid tumors, for example, we don't know if people who are going to be on this for a long time are going to develop thyroid cancer. We don't know. And also, they are taking action, preemptive action, to say that if you have a medullary thyroid disease, or somebody close to you had thyroid cancer or something like that, you may be excluded from using some of these things just as a preventative thing, even though it hasn't been seen in humans. It was seen in animals. So those may be precautionary things to take into consideration.
That's why it's very important that you cannot just start using this medication without consulting with your doctor, who knows your medical history and can suggest that this medication is good for you or is not good for you.
Definitely. And to do the side effects, I know these are the issues that the doctors will be doing. To start with a lower dose and increase slowly. And the fact that somebody lost weight so huge and you want to lose weight, you like, no, 2.5 is too small, or 1.0 is too small, 0.75 milligrams is too small, depending on which one you're using. Doctor sent me 5 milligrams, give me the 10 milligrams of the Manjaro. I know somebody who is using Manjaro 15 milligrams, and you are giving me only 5 milligrams or 2.5. It is something you start slowly, and depend on how much you can tolerate, you go up. Some people don't even need to go up from the initial dose because they already start shedding the pounds right away. So why bother with more side effects, going up on the dose when you are doing fine with the lower dose, So that is one thing.
Yeah, and also you can manage the side effects by eating smaller portions, right? Eat smaller meals and avoid fatty foods. So that will help with the nausea and the discomfort from coming from such foods. So that's the way to manage the side effect: small portion and also avoiding fatty foods.
And also, you stay hydrated. If nausea persists, then you have to make sure that you report it. But if you are puking up in the first couple of days or maybe a week, then you definitely need to stay hydrated. Drinking more fluids will definitely replace the fluids that you will lose. So, who should consider the GLP-1s? We're going to run through this quickly. I think we may have even hinted earlier on. So, people with type 2 diabetes and with uncontrolled blood sugar problems. We're just going to leave it there.
Uncontrolled. So, like, you've tried everything, you are eating the grains, you are monitoring your sugar,
doing your exercise.
you are doing exercise, and you seems not to be able to control your sugar levels. This is something that you can consider and talk to your doctor and see if they can switch your medication around so that you can try this medication. And also people with diabetes and heart disease, so if the doctor is saying that, sometimes you have this heart pain and your diabetes has advanced to a point that your chance of getting heart attack, heart disease is high, this is something that the doctor can consider.
Or even stroke, because remember we saw the reduction in cholesterol or LDL levels. So you want to prevent further inflammation and prevent a potential for clot from happening. So if you have a risk factor for heart disease and stroke or cardiovascular disease in general, then you would definitely benefit, especially if on top of that you have diabetes, right?
And also people struggling with weight and diabetes, you seems not to be able to shed any pounds. You try a whole week, you do dry fasting, and you cannot even drop 5 pounds. Or you drop the 5 pounds, and the next week you pick 10 pounds. You're struggling with your weight. You're doing your best, you're exercising, you're eating right. Sometimes you need a little help. This can be something that you can talk to your doctor.
Need a little push. Come on, man. Need a little push from the Ozempics and the Wegovys and the Manjaros, right? All right. And then people who can't tolerate diabetes medications, but I don't know how they dealt with it because these medications just came out. So before the medications, if you couldn't tolerate your metformin or your glyburide or whatever, glipizide, then you're on your own. But at least now you got an option for an injectable. And trust me, the insurance companies don't easily give in. They always want the doctors to speak to them first. Why are you giving this person this when they haven't used insulin, when they haven't used this, when they haven't used that? Please try this first because of the cost of these medications. So don't just go and bother your doctor if you can tolerate it, your medication,
yeah, and
right?
Also people are not able to tolerate it because sometimes they don't remember to take their medication. They easily forget to take their daily medication and they run out of the house without taking their medication. And the whole day they go without taking their medication. And some people carrying their lanterns with them throughout the day. You go out to eat, you have to step to the bathroom, go inject yourself. You're traveling, you're on vacation, and it becomes tedious. And it gets to the point that you're not able to control your blood sugar because you are not being compliant. You're not taking your medication because of the burden that comes with it. Remembering to take your medication every time. But this one is once a week. You pick one day, you inject it, and that's it. You don't have to remember the next day and the next day. The only time is once a week. So I think this one is also easier to use, and that also can help regulate your blood sugar easily.
All right. So now, who should not use the GLP-1s? If we're talking about who can benefit, who should not? Okay, the first group of people is type 1 diabetics.
Yeah.
And then also, yes, I think I mentioned this already, somebody with a history of medullary thyroid cancer. If you have had thyroid cancer before, you probably should not. Well, you should not. It's contraindicated, which means you should not take it at all.
Yeah, and people that are pregnant and
breastfeeding.
Feeding women cannot use because maybe you just had a baby, you know, and you want to drop all the weight in a month or two. You don't want to do that. Come on. You have to breastfeed your baby. If you have to breastfeed for 3 months, 6 months, you don't have to think about GLP yet because you're breastfeeding. It's not safe for the baby. So you have to give yourself time. So after you've weaned the baby and you're ready to, lose weight, that can be something you can consider. And people with history of what? Pancreatitis
Yes.
is not recommended.
And I think we also mentioned that, right? Because it can cause as a rare side effect pancreatitis. So if you have pancreatitis before, then you should not, go and take something that can potentially make you have it, which is a very painful condition for people. All right. So cost considerations, which is another very important aspect of the presentation. It's very expensive. Without insurance, these medications can cost upwards of $1,000, $2,000. I don't know why it says $1,300 because I've seen it
more than that,
yeah.
Right?
So again, my AI is wrong on this side. Yeah. So you definitely pay more depending on the brand, though. Maybe it's just for the older
maybe
brands.
Average,
maybe the Victosas and the older kinds, the Trulicities may be cheaper. But once you hit the the Manjaros and the Zepbounds and those who are really weight hitters, you are probably going to pay more than that. And most of the insurance companies don't pay for the Zepbound because they know. I mean, it's indicated for weight loss, and everybody wants to look great. So people are just going for that, and they do not pay for it. But they may pay for. Most of them pay for the Manjaro because it's indicated not just for weight loss. It's for other things like the cardiac issues and diabetes.
And they pay for the Ozempic too.
They pay for Ozempic
if
too because it's for diabetes.
You're diabetic. Yeah.
Yes.
So sometimes when we try to fill such medications, it's to ask you for diagnosis code. And if you are not diagnosed with diabetes, it's likely that you are going to reject it. And sometimes too, if you are borderline, your doctor just have to do the paperwork and you may get an approval to get it filled. So you have to know where you stand when it comes to and I know that most insurances have revised their formulary. Yeah, and most of them have started paying for Wegovy for weight loss. So if you are interested, you have to start with your insurance. You have to talk to your insurance and see if Wegovy is on the formulary. And if it's on formulary, the doctor just have to fill a form to get an override, and you may qualify for one of these medications.
All right. Let's see what else we got. So we have more. Probably gonna.
We also have manufacturer coupons, right?
Yeah, manufacturer coupons are
out
also there.
I know. Sometimes I recommend it to people and they get. So with the manufacturer coupon, you can get it as low as $650.
$650. Not $650.
$650.
I'm telling you, these things are expensive. Yes.
It's expensive. But someone came through my drive and said that, Oprah is taking it and she's fine, so I'm going to pay whatever amount so that I look great. So people have their own thing going, and people are spending a lot of money. And the drug manufacturers are making a lot of money.
Oh yeah, they will make a lot before they become generic and stuff.
Yeah.
All right. So the bottom line, GLP-1 medications offer a triple benefit, right? Triple benefit: better blood glucose, weight loss, and heart protection. And these benefits go beyond what other diabetes medications could provide. And that is the key for our show today. Like it's not just for weight loss that people think, or it's not just for diabetes. The heart benefits are what makes us feel that they are very, very important. Very, very important. So you got to take action today. If you have type 2 diabetes, ask your doctor if a GLP-1 medication might be right for you, and share this post to somebody who may also need it. I have, before we wrap up too, I have what we call a rhythm for life, practical rhythm for life. That's the key takeaway. I think that's what we have already said. But I just want to add that maybe a quick thing for people who may be considering this, right? Best for, let me just read it quickly. So if you are looking for something best for heart disease, best for your heart, or protect you from your heart problems and diabetes control, then what you go for is Ozempic, Victoza, and Trulicity. So if your goal is to protect your heart and also do well with diabetes, then Ozempic, Victoza, and Trulicity are your choice. And then if your goal is for weight loss and diabetes control, so let's pay attention well. If your goal is to lose weight and control your blood sugar, or you are diabetic, type 2 diabetic, and you are overweight, or you want to keep your weight in check, then what you want is Manjaro or Zepbound or Wegovy. So the weight loss usually are the Manjaros, Zepbound, and Wegovy. And then the last one is if you are just looking for weight loss alone, you don't have diabetes, you don't have many heart issues, but you feel too big for yourself and you want to lose the weight and you can pay for it, then what you do is Wegovy or Zepbound. Because most insurance won't pay just because you want to lose weight. So for that person, then Wegovy or Zepbound will be your choice. So very important. Our theme for this show is for best heart protection and diabetes control, because we talk about cardiovascular diseases and diabetes on this channel, right? So for you, Ozempic or Victoza or Trulicity may be what you want to do. You have any last minute things to say?
Yeah, so weight, like I said earlier, is linked to a lot of things in our body. So if you are not able to control your weight, your chance of your blood pressure being high, your sugar not well controlled, and your cholesterol level all over is great. But there is help out there, So the GLP is one. But that shouldn't be just one thing you want to do. We have to look at it in a broader form, right? You still have to exercise. You still have to keep moving. You still have to make the right choices. You have to pick the right foods. And so take your health into consideration. It's something that is up there, You want to do the right things and be good to yourself. So the untold story is clear. GLP-1 ones are powerful cardiovascular medications. They are out there. So take action. Do something, if you're not comfortable with your weight or your levels and your numbers, talk to your doctor. There is definitely help out there.
But it's not just for weight loss.
Yes.
Or diabetes.
Yes.
It's for
or cholesterol or blood pressure.
It's a multi-pronged attack.
Multi-pronged
attack, yeah. But they must be used correctly though.
Right.
And also used under medical supervision, like we have said over and over again. Because as time goes on, because of the popularity, because everybody is looking for it, you're going to see more commercials and people trying to sell it online. Because Viagra is online. You can buy Viagra online. Why?
Yep.
Because it's popular with men. And so with weight loss, same thing is going to happen. If you don't take it, you're going to get a source that is not right. You'll be injecting yourself with something that may eventually hurt you. So make sure you are getting it from the right places and also from a doctor's prescription. You can't just stay home and begin to make up, excuses for online somebody to prescribe something to you and they will ship it to you, not regulated by the FDA or anything like that. I'm not saying that all those online companies are like that, but you got to do your due diligence because it's a popular medication and expensive. People are going to fake some out, and you don't want that to happen.
And we have only the brand name approved by FDA, right? But they are selling the generic out there.
The FDA have allowed, yeah.
Oh, they've allowed.
Yeah, that's why they sell the generics. So people are compounding the generics.
On their own.
Yeah.
So sometimes if you don't know the source, and it's not being monitored, you have to do your homework so that you make sure you're getting it from the right source.
All right. So if this show or this live beat, this beat live show helped you get some valuable information, don't forget to hit the like button and share this video with some people who may also benefit. And not forgetting to subscribe if you're not already subscribed. We got some people who watch but they are not subscribed. Subscribe and hit the bell so that anytime we go live or we post videos, you will be one of the first to see and be able to connect with us so that we can enjoy on all the platforms that we also have. You can check more out. Anything more?
Until next time, stay informed and stay healthy.
All right. And we say,
Beloved, we wish above all things that you prosper and be in health, even as your soul prospers.
Thanks for watching.
Thank you.
God bless you. See, this will work. And if you are watching, I think the next video that is posted out there on this corner will be something you will enjoy. So make sure you hit that and then enjoy it. If you are watching on YouTube, on Facebook, if you click, it will not go anywhere. But those on YouTube, you can click that and watch another video. And if you have not subscribed, hit on the image on the bottom there, also my photo there, and you will be subscribed if you have not already subscribed.